Did I make it back? What time is it?
And we are live, Senators.
All right, terrific. So we are back. This is the Senate Health. This is Senate Health and Welfare Committee on February 10th, and we're resuming our testimony on S56, the Child Care Early Childhood Education Bill. And we have with us another Elliot Haspel, and thank you for being here. You can, if you can come live, that would be great.
Yes. Hello, Senators. I am coming to you remotely from Morocco, so I'm gonna have to keep my video off, and I hope that the connection holds. I'm working remotely from here this month, so I've asked Alex to let me know if my audio gets unreasonably choppy.
Well, thank you.
Can you hear me okay right now?
Yes, we can hear you perfectly. I'm sorry that we can't see you, but we do have some little oranges on our desk that are from Morocco. So there's a bit of Morocco.
Well, there you go.
All right. So thank you for being here. We did introduce ourselves earlier, and to save time, please introduce yourself and go ahead with your testimony, which we do have on our webpage.
Great. So yeah, Chair Lyons and respected Senators, committee members, getting to speak with you today. My name is Elliot Haspel. I'm a nationally recognized expert on child care policy. I'm author of the book Crawling Behind America's Child Care Crisis and How to Fix It. And I'm also the director of Climate and Children at the think tank Capita. I'm particularly excited to testify before you this morning because I've been following Vermont's efforts to build an effective, high-quality, affordable childcare system for many years. Vermont has long been in the vanguard of childcare efforts as one of the first states to set an affordability target, one of the first states willing to put hard numbers behind what it would really take to get there. Progress has happened under different political administrations. Truly, the Green Mountain State has much to teach the nation when it comes to childcare policy. My main message is for you today. I appreciate the work that has gone into crafting S56 and all that came before it. I want to relay that the research shows in order to accomplish your laudable vision, it is critical to expand subsidy eligibility, universal or near universal, as well as to have a mixed delivery preschool system. The absence of these policy elements not so much have unintended negative consequences as have predictable negative consequences that will hurt the very people you're trying to help. I want to begin actually by reiterating why childcare in the United States is so badly broken, why it works for no one involved. And I know this may be somewhat repetitious to some of what you've heard before, but I think it's important to put a fine point on it. Childcare is and should be an exceptionally expensive human service to provide. Low child to adult ratios are necessary to ensure both safety and enriching interactions. I taught fourth grade in a public school for a few years. I frequently had as many as 30 children in my class. And while that was certainly too large of a class, it was allowed. In Vermont, as in many states, the maximum ratio for 2-year-old classes is 1 adult for 5 children, and no more than 10 children in any given classroom. But despite the cost pressures on childcare, Vermont spends nearly $20,000 per 12 child versus less than $4,000 per child aged birth to 5. So you can see the challenge. That is, of course, the answer to the vexing question of why parents pay so much. Early educators are paid so little. Even though parents might be charged $10,000 or more a year per kid, programs are taking a loss compared to what they should be charging, especially for infants and toddlers, where the ratios are the lowest. And so the only way providers can keep the lights on is by cutting educator wages. You're no doubt aware by now of how the lack of an effective childcare system has deep economic consequences. I would add the consequences go beyond dollars and cents and into core questions of values and freedom. Far too many parents today are forced to make choices about their work care situations, not around what's best for their families, but due to the availability and affordability of childcare. Far too many parents today are forced to make choices about how many children to have, not due to preference.
Uh-oh.
We do have this written testimony. Yeah.
Uh-oh. Elliot, if you can hear us, we cannot hear you. He's still there.
Sorry, I'm back.
Okay, good. Terrific.
All right. Sorry. Far too many parents they're forced to make choices about how many children to have, not due to preference, but due to the availability of childcare. And far too many parents today are forced to make choices about where to live and whether they can invest in their community, not due to desire, but due to the availability and affordability of childcare. And that's not hyperbole. I was struck by an article I came across last October from the Valley News, and it was entitled "Lack of Childcare Forces Out Families." And it reported that in the small town of Woodstock, Vermont, the Woodstock Economic Development Commission had found that 27 families with young children could not find childcare, and quote, 6 of those families were moving away because of the issue. And in a town with a population of 3,000, that's 6 vital family trees uprooted. So how can you structure your childcare system to ensure it's family-focused, child-centered, pluralistic, high quality, and respects the hardworking professionals who show up every day? First, it's important to understand the specific mechanisms by which using subsidy assistance to fund a childcare system actually work. The Boolean proposition, if I may, is this: if the subsidy amount is set high enough, and if enough families are enrolled in the subsidy program, then enough money will flow into enough childcare programs to allow them to raise wages, sustain their quality while remaining affordable. So let's take each of those 3 elements in order. First, if the subsidy amount is set high enough, and here S56 meets the mark. It requires establishment of cost of care reimbursement rates as opposed to the current inadequate, artificially depressed market rate surveys. Using these cost of care rates is established best practice. It's been adopted by New Mexico, Virginia, and is under active consideration in several other states. Next, it's if enough families are enrolled in the subsidy program. So in any given childcare program, there's going to be a mix of parental income levels. In order to get enough funding to meet S56's educator compensation scales, programs are going to require nearly 100% of their families to be paying the new higher cost of care rate. S56, as you know, expands family eligibility to 450% of the poverty line, which is a good start. But having a subsidy cliff at 450% means that many programs will end up with some subsidy families and some non-subsidy families, given that around 20% of Vermont's young children live in families above 500% of the poverty line. And what does that mean in practice? Well, consider the final clause. Then enough money will flow to enough childcare programs to allow them to raise wages and sustain quality while remaining affordable. In programs that serve those families over 450% of the poverty line, who are not eligible for subsidy, those families struggle to pay the true cost of care. So programs are going to face a difficult choice because they don't actually have enough money flowing in. Either they're going to have to massively raise the rate for all non-subsidized families to put them equal with that cost of quality rate. And per the RAND report that was commissioned, that could be up to $30,000 or more per child in toddler classrooms. Or they're going to have to find a way to reduce costs to make up for what the shortfall they now have. And that could look like cutting quality corners, trying to hire less experienced staff who don't require higher wages. None of those options are particularly palatable, nor do they produce the outcomes for children that we're all working towards. So the solution is simple, if not easy: extend subsidy eligibility to be universal or as close to universal as practicable. That's, after all, how we handle public schools. They're free for everyone, even the richest households, but those households are taxed at a higher rate to compensate. And that spreads the burden among all taxpayers for a service that benefits all of society and all taxpayers. What this would on a small pool of middle income and upper income families. I want to reiterate what many of my colleagues and the other witnesses and other national experts have said about how dangerous it is to pursue a public school only pre-K system. There are a few reasons for this. As you've heard, pulling 4-year-olds out of childcare programs is devastating to those programs' budgets. Thinking back to my point earlier about ratios, preschool age classrooms have the highest allowable ratios, so the per child cost is lowest. And we have empirical evidence from many states and cities about how this approach reduces the overall supply of childcare. Moreover, providing pre-K on a school day, school year calendar is not what most parents ultimately need. Most working parents require many more hours and days of care. And unlike elementary school, middle school, high school children, it's not so easy to send a 4-year-old to an after-school program or drop them off at a neighbor's house for a couple hours. So some kind of childcare will still be needed to provide part-time care to those same pre-K kids outside of school hours, but now there are going to be fewer programs left to answer the call. finally submit more philosophically, the school-only pre-K reinforces an artificial division between childcare and pre-K. Pre-K is in the end also a form of childcare. It's all better termed as early care and education. And that division actually has historical roots. If I can quote myself from an article I've written on this, historians Schoen and Michel has explained that the earliest child cares were known as day nurseries. They're founded in the late 19th century as a reluctant charity for women who were forced to work due to widowhood or divorce. They were poorly funded, poorly maintained, horrifically overcrowded. One adult could be responsible for 25 to 35 children under the age of 5. Those programs were forced to truly be little more than holding pens. In contrast, Michelle writes, the leaders of the forerunners to preschool programs, which were known as nursery schools, quote, took pains to differentiate their institutions from day nurseries. They feared the association with these custodial institutions, but had suspicion on the lofty educational benefits nursery schools purported to offer. From the very start, Michelle says childcare was treated as preschool's, quote, poor cousin. So, well, childcare, though, has come very far since those days. We now know that high quality early care and education can be delivered in any setting, so long as there's adequate support for the professionals involved. But the disrespect for childcare remains. We still call it two different things. And I say this is dangerous because splitting child.
Uh-oh,
We just lost him.
we just lost him.
We have his written testimony.
Let's keep reading his testimony briefly, so, and then we'll just read quietly and we'll come back.
All right, I'm back again. Sorry, I'm almost through my testimony. I call this split dangerous because splitting childcare and pre-K works against the goal of a comprehensive birth to 5 early care and education system. And in the end, that's the system needed to support the diversity of families' needs and to support families to flourish. And flourishing families do more to improve child development, school readiness, and overall child well-being than any specific program. So as Vermont continues to lead the nation on early childhood issues, I implore you to consider revisions to S56, which would ensure coverage for childcare subsidy or as close to universal as you can get, and ensure a fully mixed delivery pre-K system where families have equal access to whatever kind of pre-K setting best meets their needs. Doing so will continue making your state a beacon.
He's cut out again.
No,
Thank you
that's
very
fine.
much for your time, and I would be happy
I
to take
know.
questions. There you go.
Elliot, you've disappeared again.
I apologize, senators. I've got 2 sentences left, and then so I'm hoping I can just Morocco will cooperate. So doing a mixed delivery system will continue making your state a beacon that brightens the future not only for Vermont's children and families, but for the entire nation. So thank you very much for your time and your patience, and I would be happy to take any questions.
Thank you. We have your testimony, which has really been a great help, so we've followed along. So I do have a question. It's a question I asked earlier regarding the expansion of entitlement hours from 10 to, I picked the number of 40, and whether you thought, given your perspective on having mixed delivery and that more is needed than the school sort of drop off and pick up, rather to have a center that fits families. That's what I'm hearing from you, at least I think. So what would be your thoughts around an expansion of the entitlement hours?
Yeah, that's a great question. I think that is certainly one approach. I think primarily the way that you're funding the system is through the subsidy, though. Again, like that needs to be it needs to be accessible to enough families that they can use it at enough different places, or the mix is going to end up. So I think extending the entitlement would certainly help, but I don't know that it necessarily solves the strictures that a subsidy-based system require in terms of how many the uptake that is required, essentially to flow the money to enough programs to keep them not just solvent but high quality.
Okay, yeah, so it would, for me, it's two separate things. You need to do both. Subsidy as well as.
Correct.
All right, questions committee for Elliot in Morocco. No questions. You've made a statement early on that mixed use is preferable as a delivery system for childcare. And so that is an assertion that you made. And so could you talk very briefly about how you have arrived at that conclusion? He didn't.
It's really hard to
Yeah.
listen to this.
We'll send him a note. We'll send him the question.
All right. I apologize again, senators. I can try to answer that question, or I would also be happy to respond in writing to any questions that might be more
So did you hear my question?
back. No, sorry, you cut out.
I'm gonna ask it one more time and keep my fingers crossed.
Okay.
You made an assertion early on that mixed delivery is the best way to go, just to shorten it. And
Yes.
so how did you reach that conclusion?
I reached that conclusion several different ways. One is, I think, as you heard from, it's not like I caught the tail end of Lori's, feedback. There is certainly evidence that high quality care can be delivered in any kind of setting, and so I did most of my work for the past 6 years in Virginia. Virginia did a pretty extensive study of its mixed delivery system, and again found the outcomes were equivalent in private programs as in public programs. So I have some firsthand experience there. And then the other piece of it is, I think, the overriding need for a vibrant choice like system where parents have enough access to early care and education systems. The damage to family flourishing and the damage to child well-being of not having that in place, I think, outweighs, in my estimation and in my read of the evidence, any sort of quality gain you get from going to a purely public system. So the knock-on effects, the externalities, if you will, outweigh. It's a bigger equation than just asking the simple question of, on average, is a public school program
Okay, yeah,
higher quality than a private one.
I understand. And you did allude to that in your, or you did address it in your testimony.
Yeah.
Thank you.
Yep.
Senator Gulick, you had a question?
Actually, I have a comment, so I could keep, it can just be within our meeting.
Any other questions, committee? Okay, well, we're going to put you out of your misery because I know it's been difficult for you. And we appreciate your patience with the technology. And we're actually pleased that you're able to be here with us. So thank you. And
Well, thank you very much for the opportunity, and yes, appreciate your patience as well.
okay, thank you. And so we'll maybe have an opportunity to send questions to you as needed, and then hopefully have a continuing relationship. So thank you.
That would be great. Thank you very much.
Okay, good. Now, Senator Gulick, you want to make a comment?
Sure, thank you. Just a comment to the committee members that just listening to a lot of this testimony, for one of his points, which was don't divide pre-K and childcare, I couldn't help but think to myself, like, our system already has these arbitrary divisions all the way from beginning to end. Why is 12th grade separated from 11th grade? Why is first grade separated from second grade? Like, that is part of how we deliver education and instruction. Just wanted to point that out. So I keep hearing that they keep talking about these limitations to the public system, like the hours in the day and summers and so on and so forth. Again, I kind of feel like those are arbitrary limitations that we've set. They don't exist in nature. So you could potentially fix those systems that we've created in the, so that kind of has been irking me through a lot of these testimonies, just generally. And then, I'm steeped in public education.
Yes, you are.
So I often find that like you want the best for high quality, individualized care. For me, sometimes it just feels a little bit coded that we can't do that in a public education system, and it has to be separate. And it creates a schism between two systems that I don't think are necessarily at odds. And it just, again, makes me bristle a little bit, like that all of that can be enveloped into a public system.
So, and I think that's what we're talking about here. So one of the questions that I have about that, and I see Elliot turn the screen on, so maybe you would like to make a comment, and I'll maybe make a comment, maybe not.
No, I appreciate that. And I appreciate the senator's comment about the public education system and some of the, the things that feel arbitrary. A lot of my work is in education as well. And I guess I would emphasize from our point in the systems analysis, we were not in any way trying to cast aspersions on either agency that we were talking to or any of the providers we were working with, right? I mean, our experience was, again, coming in as outsiders, that we saw a lot of really exciting work happening in public schools and in private settings, and that there's a great deal to build on at the community level. To some degree, the challenge is that those worlds have some different cultures, right? And again, that's just grown up over time. I'm not saying one is better or worse than the other. Both are eminently capable of delivering high quality service to families, but that as things are currently constituted, that they have some different norms and expectations and ways of behavior. And that, again, in Vermont, as in many states around the country, they just feel like different worlds and they don't always work well together for that reason. And that one of the things that states have been trying to do is break down some of those arbitrary distinctions, right? I mean, in many states, and Vermont, I know does it a little differently with pre-K, but that pre-K was historically seen as an educational function in an education agency, whereas childcare was seen as a human services function in a human services agency. But that as states get deeper into it, and now that they've had these programs for, a couple of decades, they realize that they're all really part of the same ecosystem, and that having strong leadership that's focused on that ecosystem in collaboration with education and other human services is often really valuable. But very much want to emphasize that, at least from the systems analysis perspective, we were in no way trying to say anything negative about either private providers or the public school system.
Thank you.
Okay, yeah, and one of the questions that we'll get to as we go forward is the relation, the age issue. We talk about arbitrary break-offs for age at different levels, but 3 and 4 year olds might be slightly different from 15 and 16-year-olds. So that's something we'll have to dive into here.
Yeah, but all education is childcare and all childcare is education.
No, that's all. It's mixed. So then that's the other question regarding mixed delivery. And we currently have, and that we're trying to make our pre-K exemplary. But can you talk a little bit, Elliot, about the concept of mixed delivery and then moving toward a more robust pre-K system?
Sure. Well, I mean, in that sense, one of the things about mixed delivery that's really important to understand at the local level is just how interdependent it is, right? And that the right balance among providers, right, be it school-based or in a Head Start center, or a childcare center, there's no magic right answer to that. It really is very community dependent. And part of the challenge that, again, some states and communities have wrestled with is that when pre-K is overseen in one way and childcare is overseen in another way, that those sectors end up feeling like they're competing with each other instead of having one oversight body that's looking at the whole of service delivery and that can work with communities to say, okay, you know, in this community, the school has ample space and they want to hire a teacher, and that they're really collaborative, and the private providers really like that. So here we're going to fund school-based, and we're going to oversee it in a way that supports that kind of local collaboration. Whereas in another community, right, again, in some communities where the school is overstretched, right, they don't have room, they don't really want to hire the teachers, what they really need is support for collaborating with private providers, and that the providers should really be the primary service delivery mechanism. That's all okay, right? I mean, there's no right or wrong there. It's just different communities have different needs and interests. And so, but those things are all very interrelated with each other, right? And to use Head Start as an example, in some number of communities where population is shrinking around the country, you'll hear Head Start providers saying, look, like, we got funded by the federal government, but that if kids leave our program to go to state pre-K and we can't fill those seats, we end up sending money back. So let's think holistically about, like, how do we provide services to as many kids as possible by leveraging Head Start and pre-K dollars together? So I think it's that kind of holistic thinking that makes for the most successful mixed delivery systems, because, and again, a lot of that happens already at the community level, but that parents aren't thinking, oh, I want pre-K instead of childcare, or Head Start instead of pre-K, right? They're thinking, I want somewhere where my kid's going to have a really good day with someone who loves them and ideally learn something, right? They don't think about funding streams. They think about, like, do I trust this provider? Do I, you know, is this convenient to where I'm driving? Is my kid coming back at the end of the day happy and excited? So the ability to think holistically about that at both the state and local level is what's really been most powerful in serving parents who want to give that kind of experience to their child.
Thank you. That was helpful. Appreciate it. Any other questions? Okay, good. This is good. I thought someone was coming in. Is it the BSCA? Were they coming in? All right. Okay, well, before you leave, I just want to heads up for next week, because it's Friday, and I want to do that with a couple things. One, we're hearing a lot of testimony. We're going to continue to do that. We each have a lot of things going on in our heads. We want to talk, and I'm glad that there's some comments. We need that. We will, as we go forward with this bill, as well as with S37, as we start talking markup, when you see that, that's our opportunity for discussion and trying to sort out where we are with what we have heard. So we'll get to that place. Probably not soon on this one. We have a week next week where we're looking at finishing up testimony on S37. We're going to go back to this bill, S56, and we'll start to really fill our days with S56. And as S37 leaves committee, I'm also going to be putting other bills on the table that we can take up and try to complete before crossover. So they just want to know where where we are. And as I said earlier, education will be doing some of its work, and I'll be working with the chair of education to help provide some of the information that we have if he needs it or wants it. So we're good for the day. It's a lot. There's a lot of thinking. We all have our own perspective on this, but I'm trying to. It would be great if we could do everything that's in the bill. Let's see where we can get to. That's the world we live in. So we can go off live.